The initial step in the pellet procedure is making sure the patient is adequately numb. After this has been successful, we make a small incision in the skin. Right now you're seeing a female patient. This is her right upper buttock, but the location is the same for males and females. Then after the skin is adequately numb, we insert an instrument called a trocar to the adequate depth. While this might seem intimidating, we're actually only going about a half an inch under the skin at an angle above the muscle layer. Now that we're at the appropriate depth, the pellets are placed. This patient is receiving 1 pellet, but most patients will receive anywhere between 1 and 12 pellets, depending on the patient need. After the pellets are placed, this incision is closed with steri strips. Most patients will begin to see benefits after 2 to 3 weeks post-insertion.